There are problems that begin at birth. Even though we may be good at braces, we're not doing anything to stem the tide of malocclusion or crooked teeth. You start treatment when you discover that poor habits that are going to create problems, and you address the habits, not the teeth. There are problems that begin at birth. We can see problems as soon as a baby tries to nurse with its mom. We can see problems within the mouth, with the tongue, with functions that are eventually going to affect the way the jaws grow. Studies show that 100 years ago we didn't need to breathe nearly as heavy as we do now. Many kids are walking around with their mouths open, their tongue hanging down away from the roof of the mouth, and this alters the way the jaws grow. So our faces are changing. They're changing in their size and shape, and teeth try to come in and fit into jaws that are undersized and just don't have a chance. Orthodontics pretty much overlooks that phenomenon and just looks at straightening the teeth. But one of the side effects of that kind of thinking is that when you don't have enough room for the teeth, often you wind up taking some of them out as part of the solution. Well, what MyoBrace does is look at those underlying causes and tries to deal with them. We teach kids to breathe through their nose, keep their lips together, keep their tongue resting on the roof of the mouth so the jaws can grow in their proper and full size. Then there's plenty of room for the teeth, and often the teeth will come in straight even before you get to the braces. In this part of the world, we're on the forefront, but really all around the world, people have recognized that this is a better way to do things. Yeah, see, she was doing pieces there. I don't know if it's done yet. Well, the MyoBrace activities are an important part of the treatment, just as important as wearing the appliances. The activities are really teaching the kids the good, healthy habits that help the face grow properly. So they deal first and foremost with breathing. We want children to be able to breathe through their nose using their diaphragm at a low volume that's sufficient for the body's needs.
During the light breathing activity, I will explain how to breathe through your nose using your tummy muscles while you are standing, sitting, or lying down.
Second thing is we want to teach good lip and tongue posture so that whatever function that the child's going to be doing, whether it's chewing or swallowing or speaking, the tongue is in the right place to begin those movements.
Start this activity by placing the tip of your tongue just behind your front teeth, where the roof of your mouth.
And then lastly, we teach about swallowing, because that's a very basic function that can work against the way the teeth come in and often works against braces too.
To begin, make sure the tip of your tongue is on the spot. You will need to make sure it stays there while you swallow.
By teaching good breathing, lip posture, tongue posture, and swallowing, we set the trajectory of growth in the right direction.
The MyoBrace appliances work by teaching your tongue to rest in the correct tongue resting position. Breathe through your nose normally and swallow the right way.
People ask me all the time, when do you start? And for most people, their thinking is that it has something to do with the teeth. The premise behind this kind of treatment is you start treatment when you discover that poor habits that are going to create problems, and you address the habits, not the teeth. It's a very different way of thinking.
Yeah.
Yeah. So now we're trying to look at the reasons we're getting sick, and there's a lot of work being done in both medicine and dentistry looking at these root causes and trying to deal with them. When you consider the fact that just a few hundred years ago the teeth were not crooked, it can't be in the genes. Genes don't change that fast. Our genetic structure now is the same as it was 20,000 years ago. So it's not really a genetic phenomenon at all. They call it epigenetic because our genes are being triggered by the interaction with the environment. And again, we're talking about things that we're eating that our bodies never had to eat before, things that we're breathing that our bodies never had to breathe before.
Almost every packaged food contains sugar in some form or another. If you look on the back of the packets, you will find the hidden sugar content. Here are a few to look out for: sugary breakfast cereals, cookies, cakes and pastries.
Well, I know it's the future, just as the future of medicine has to be looking at root cause, the future of orthodontics is also going to be looking at root cause. And because we're just taking care of the symptoms and not really the problem, conventional orthodontics will have a place because it is important to look nice in our society, but it's more important to be able to breathe well and to be able to get a good night's sleep and to have good, good health because of it and so forth. So at least a segment of orthodontics is going to be devoted to helping children develop good airway, good breathing, good posture, and good health.